Test for neuropathy. People that come to us, when they get here, we're usually not the first choice. We are usually the last resort. They've already had different types of testing, MRI, X-ray, circulatory tests, nerve tests like EMG or NCV, where they put needles in your arms or legs and shock you. And that really doesn't feel good. Those tests have their time and place. So if you've had those tests done, bring those to your discovery call, or we can go over them at an in-office appointment. Our neuropathy testing comes in 2 phases. To understand these phases, you would first have to understand how your body works as a whole unit and not individual parts. So with my TriWell Plus testing system, we look at you as a whole person. The system is based on the fact that we are a mental, emotional, spiritual side to us. We have a metabolic or nutritional side of us, and we have a structural or physical side of who we are. By looking at all 3 aspects of your nervous system, we can get to the root cause of that condition. So first, nervous system, brain and spinal nerves, metabolic system, gut health, toxicity, deficiency, and in the structural system, bone, ligaments, and muscles. And you can find out exactly what's causing the problem. When you find that out, it is much easier to find a solution. It's much easier to be committed to an action plan to getting better when there's scientifically proven results to reverse your condition. Unlike traditional methods that focus on symptom relief and not correcting the root cause of the system, the TriWell system delves deep into targeting the 3 main categories at the root of neuropathy. First, neurologic, we examine the brain, the spinal nerves, and the peripheral nerves, which are the ones in the hands and feet, focusing on restoring balance and function. Next, metabolic. We assess gut health and identify leaky gut or intestinal permeability issues, inflammation, food sensitivities, biotoxic exposure, nutritional deficiencies, and finally structural. We evaluate the bones, the ligaments, the muscles. We want to ensure that they're supporting your body correctly. Alignment issues are a common cause of neurologic problems and neuropathy. The first phase of testing is to see if you have neuropathy and what stage of degeneration is it in. The second phase of testing is to determine what's the cause of the neuropathy is and what therapy needs to be done to reverse it. Now, most neuropathy is sensory related, meaning that basically the neuropathy attacks the nerves that tell you when you feel things like temperature and texture. These nerves control balance. So often people will begin to have balance issues when this goes. Medical tests that are done oftentimes don't read those things. And so they're not specific enough. So we have to do specific testing on these nerves to see the function, whether they're functioning or not functioning, see how much damage has been done up to this point, and if we can help. Also, people come to us, they have circulatory tests done by their cardiologist. And when they're done, they said, well, the test looks normal, everything's healthy and all of that. But we use a Doppler ultrasound to check the small microvascular blood vessels. They're actually checking more for the bigger blood vessels, the ones you might see on the back of your hand or on the top of your foot. So the test is designed to more look for blockages in the vessels like plaquing and blood clots or peripheral artery disease, but not the microvascular circulation. So we use thermographic imaging instead. That helps us look at the blood flow and circulation as a whole for your extremities, arms and legs. There is a test where you can actually check nerve conduction to see how the electrical signals are going. And a lot of these tests that we're doing are standard medical tests, but a lot of doctors' offices won't do them because they know that whatever they would recommend, medication, injections, or surgery, or some type of traditional physical therapy, that it wouldn't improve the condition anyway. And it really just designed to help you feel better is what they're trying to do while your condition continues to degenerate over time. So first phase of testing is determine if you have neuropathy and if you can be helped and what stage. And if you don't have neuropathy or we just know we can't help you for any reason, then we can point you in the right direction to try to get some kind of relief. Now, if you pass phase 1 testing, meaning you can be helped, then we start phase 2 testing. All testing depends on what was found in the consultation and phase 1 testing. Phase 2 is looking at all 3 parts of the body. We look neurologically, metabolically, and structurally. Tests for metabolic issues like gut issues, heavy metals, toxicity, biotoxins, nutritional deficiencies. Look at the physical with spinal nerve function in relation to hands and feet. We look at structural alignment, which could potentially cause neuropathy symptoms. And we look at brainwave health to see